Go. Okay. All right. Well, welcome to the community care seminar. I'm going to give you a couple of things here we're going to go through. There's a pen, there's my card. My last name is pronounced McMenemy, just call me Jay. And just a couple of questions. Just to let you know, if you go out the entrance here, just to the right are restrooms. This meeting will go for about 45 minutes. And I'm going to go through and we're going to do the ABC, so I'm going to make you just kind of understand the general information, and then we'll get into the plan information, and I'm going to give you an opportunity to enroll today as well, okay? Now, my name is Jay McMenemy. I've been in the insurance industry about 30 years, and Medicare, and then about 2006 when the Medicare Part D came in, I started into Medicare Part D plans, Medicare Part C, a lot of what we're going to talk about. So I worked with a company, a Fortune 100 company for about 18 years of those, and then I decided to branch off and start my own brokerage. It's been very good. We actually have the opportunity to staff the Walmarts. So I'm also in Walmart down the street, so I'm local for you to be serviced. So you're not having to deal with calling people that maybe you can't get a hold of. I'm a face-to-face person you can deal with, okay? I've got 3 kids, a wife. I live just up the street in Glenpool, Oklahoma, and I always answer my phone calls, just so you know, and I always return my calls. I mean, maybe I don't answer, I may be in a meeting, but I always return my calls, okay? Now, this is put out by Community Care. Tell you a little bit about them. Community Care is the largest homegrown health plan in Oklahoma. It's strictly local. They're based in Tulsa, Oklahoma. Okay, they have their largest office, which is the downtown office right off of Denver. And then they have their walk-in office, which has their senior center at 47th and Harvard. And as a member, you have access to their senior center. They also have resources, and I'm available as your agent. Really appreciate if you get a snapshot on either the website or on your way out on the bulletin board. Or text me and I can send you all my dates of my other seminars upcoming. If you know anybody going on Medicare, I really welcome them to come to a meeting as well, okay? So we're gonna go through this. And this is not actual plan information. We will get into that here in just a minute. But if you'll just follow through with me, I'm gonna define what it is you're looking at when you get on Medicare, okay? What is Medicare? You have Part A, which is hospital, okay? Has no premium, no penalty to delay. It's strictly inpatient. Part B covers your doctor's fees, lab work, outpatient. Typically includes a premium. The going premium this year is $185 a month, and that can change if you have a higher income, called an IRMA rate. That just means you made in the last 2 years over $80,000 to $170,000. And there is possibly a penalty if you don't apply when you're eligible for Part B, okay? And some of the things Medicare covers is your medically necessary services. What Medicare does not cover is prescriptions, dental, optical, hearing. All right, flip over with me here. Now, if you, we're on page 4 now. If you don't actually get a Social Security check or you didn't take early retirement, you need to enroll in Medicare, okay? I can help you and steer you in the right direction to save you and expedite that, but there is a number through the Social Security Administration that you can do that. You're automatically enrolled in A and B if you do get a Social Security check prior to getting on, turning age 65, okay? Next page, it kind of gives you the breakdown on page 5. You have really 2 paths you can take, and that's the traditional route is on top of original Medicare A and B. You buy just a Part D, kind of complete your coverage, buy a Medicare supplement as a secondary to go along with your traditional A and B, or you can go the Part C route, which is hospital, medical, drugs, and more. Generally, these plans have a network like an HMO or PPO, okay? On the next page, we're on page 6 now. You have Part C. This is known as Medicare Advantage, offered by Community Care Senior, and it combines Part A and Part B and Part D into one plan. Usually you get more benefits such as dental, vision, and no premiums and no co-pays on physician visits. You must have Part A and Part B to enroll and live in the service area. And that's one of the good news is the service area. So if you're not in Okmulgee County, I will check to be sure your county is in the service area. Is anyone in the room from a county that's not Okmulgee? Okay. Now, just to get into the next page, on page 7, to know your Medicare options, I want to just kind of get a show of hands. How many of you have employer coverage? Like you're coming off an employer plan, okay? All right. How many of you are getting a Social Security check? All right, okay? And that just gives me an idea, because that way I know if you're not getting a Social Security check, then I'm going to work with that person at the end of this meeting to show them how to enroll in Medicare. Okay, all right, so page 8, shopping for coverage. What to look for in a health insurance plan. All Medicare Advantage plans cover the same benefits as Medicare. Some cover more. You have doctors and hospitals, okay? And you may be asking, are my doctors covered? Is my preferred hospital network? Are my prescriptions covered? I'm going to go through all that with you today. Are my co-pays and medical and prescription drugs affordable for my current medical conditions? Okay. Then you want to look at additional benefits. So page 9 gives you the difference between a PPO and an HMO. A PPO does not require a primary care, where an HMO would, which you can change at any time. Okay. If you need to change your primary care, reach out to me. It's not a big deal. A lot of people already have a primary care. It just makes sense, by the way. Referrals required to see a specialist on a PPO? No. On an HMO? No as well. Not on this HMO we're talking about. Prior authorization required. Some services require prior authorization, and sometimes with an HMO, it requires a referral to prior authorization. Different than just a typical referral to see a specialist. Network of contracted doctors, yes on both. Members can choose to see out-of-network doctors. On a PPO, yes, generally at a higher cost. On an HMO, no. Worldwide care for emergency, on both, yes. Higher cost for inpatient care. Yes, on a PPO, members pay out-of-network cost share. On an HMO, no. Members typically pay a lower cost share, especially for in-network services. Page 10, okay? One thing I really like about Community Care, it's one of the few Advantage plans that has all the health systems in Tulsa, the major hospital systems. So you've got Ascension St. John, St. Francis Health System, OSU, and the Hillcrest system, which is predominantly down in this part of the area, okay? If you're in the Oklahoma City area, you have the Integra system, Mercy system, okay? All right. And you have the flexibility to pick between those 4 hospitals to flow freely on the HMO plan. On the next page, members will choose a primary care doctor, but continue to see specialists with any of our contracted health providers. If you need specialty care, not available to our providers, not to worry. Community Care has access to several centers of excellence like MD Anderson, St. Jude's, Barnes Jewish, Mayo Clinic. So that's good to know, okay? Next page. What happens when you're out of the service area? That's a question I get a lot. You have worldwide and urgent emergency care with this plan. If it's an emergency anywhere in the 50 states, it's a $90 copay, and they waive that with Community Care if you're admitted within 48 hours of a visit to the ER.
What page are you on
in
right
the
now?
hospital? I'm on page 12. Okay.
Okay.
Specialist copay for urgent care visit. If you're admitted to a hospital while you're traveling, you pay the same copays as you would at an in-network facility. So not to worry if you're in Denver or Tampa, Florida, okay? All right, so let's look at our Medicare Advantage plans. Now, while I pass this out, these are the different counties if you're in. So the nice thing about the area is you can see if you're in Okfuskee, Okmulgee, McIntosh, the general counties around here, you're eligible for this plan, all right? I'm gonna pass out the guide here. So far with everything, I've covered the basics. Is there any questions I can take right now? Okay, very good. All right, now these that I'm going over is the benefit summary. okay? One thing I want to explain to you is this is yours. Feel free to write in it all you want to, okay? As we get into the plan, all the plans are wrapped up in here. Now, there is one plan that's not in this book. There is what's called an MAPD and an MA. An MAPD means Medicare Advantage that combines the drug part in it. Now, if you do not need the Part D, maybe you're a veteran, maybe you have tribal benefits, or you get your prescriptions a different way through TRICARE, does that apply to anybody in the room, okay? There's a plan we'll go through at the end of this, if you would like. It's strictly medical and hospital, no Part D, okay? One thing I gotta tell you on that is you cannot add a separate Part D plan to that plan if you take it. This wraps it into one, okay?
Wait, which one can you not add a Part D plan to the supplement?
Just an MA only.
Just an MA only.
Okay. All right, so if you'll open
You
with
can't
me.
change the MA to an MAPD?
Let's go through this.
Asking questions.
All right, so number one, we went through, and this gives you a pretty good guide, Part A, Part B, the history, okay? Flip over with me to page 3. It just kind of tells you a little bit more about Medicare Advantage, okay? So let's go through that real quick here. Part C combines your A and B. Plus you have a low monthly premium, and a lot of times 0 monthly. You get dental and vision. You get drug coverage. You have a max out of pocket, all of which I'm gonna go through with here in just a minute, okay? So if you compare the two, just traditional Medicare, there's no prescription coverage, no dental, no transportation, no worldwide coverage. Large network though, you usually have a 20% cost share. With Medicare Advantage, you still pay your Part B premium either way. So that $185 a month, which is the going rate, you're still with me on page 3, you're
Yes.
gonna pay that either way, yes. But prescription coverage is included in most of the plans when you do a Medicare Advantage. You get dental and vision, transportation in some plans, worldwide coverage for emergencies covered. Provider network, you select your network. You generally have no copays or low copays for services and an annual max out of pocket, okay?
Okay.
Now, let me explain the drug part, because this is a question I get a lot of times. Part D is the prescription. It has 3 stages, okay? You have number 1, what's called a deductible stage. With a deductible stage, you pay before you begin to pay your deductible or your out-of-pocket or copays, if you have a deductible. The nice thing about the community care plans, you're gonna like, there's no deductible on the drug, but we'll get there. Once you go through the deductible stage, you have the initial coverage stage. Your covered drugs are sorted into different tier levels, and your cost will depend on what your level of your drugs are in. Most people stay in this level throughout the plan year, but depending on your total drug costs, what you pay plus what the insurance company pays. Caps out at just $2,000, okay, for Medicare beneficiaries. Then you move into the catastrophic stage, and this is nice. After the $2,000 out-of-pocket limit is reached on drug costs, you'll be covered in conjunction by Part D plan, drug manufacturer, and Medicare. You have no additional expense the rest of the year. So all of your covered drugs processed at a 0 copay, okay? We're still on page 4. All right, page 5. As I mentioned, if you are new to Medicare or you didn't take early retirement and you're not getting a Social Security check, this kind of walks you through, which I will also go through with you at the end of this seminar, if that applies to you, that you want to apply for Medicare, and I can show you how to do that. Otherwise, there's a penalty on Part B unless you have creditable coverage or employer coverage to where you want to delay it at this time. All right. Now, page 6, there's different windows where people can enroll. You have, when you're new to Medicare, you have a 7-month window called the initial enrollment, 3 months prior to the month of entitlement. When you turn 65 or go on Part B for the first time, the month of and 3 months after. There's special elections. If you are over 65 or you're past your entitlement, and you moved or you're coming off an employer plan, you qualify for a special enrollment. And then the annual enrollment period, which goes from October 15th through December 7th. Now that is a window each year where anyone on Medicare can select a Part C or Part D plan if they have both A and B Medicare and they live in the service area. They can change their plan, or they can, no action is needed, and they can just remain in their current plan and it will auto renew, okay? And then the open enrollment is only for Medicare Advantage members from January through March 31st, okay? All right, now flip over with me and let's go through the summary of benefits. Before I go through the summary of benefits, I want to pass out what's called the star rating, okay? Now this star rating, which I'm going to have in a separate insert, I didn't bring them in, is set by CMS that administers the Medicare program. And they run the Medicare program. And this star rating is rated on a 1 to 5 star scale. And 1 being poor overall grade, 5 being exceptional. This plan received a 4-star on what we're going to go, so that's very good. For more information on that, feel free to contact CM Medicare, 1-800-Medicare. Now, turn with me to page 1, okay? If you look with me here in the green section on this map, these are all counties that can now get this plan, okay? If you are in one of these counties, if you're not, visit with me afterwards, okay? Alrighty, okay. Now, let's flip over with me, and there's 3 plans we're gonna discuss. The more popular Silver Plus, the Platinum and Platinum Plus. What we're gonna cover that you get with these plans is you get comprehensive dental benefits, routine eye exams and eyewear, and over-the-counter benefits, non-emergency transportation, okay? On the next page, page 4, it shows you all 4 major health systems that you have to choose from. Down here in Okmulgee, you've got the Hillcrest system. Down in Henrietta and Utica Park is all part of it. Ascension St. John's, which is largely a big part of the Sepulpa network. St. Francis, they have a new St. Francis Urgent Hospital in Glenpool. You guys seen it? You've been out there, okay? And St. Francis South, what they're expanding on. Muskogee, they're also expanding on. OSU Medical, which has a satellite branch down here as well. And then other networks. All right. One thing I will tell you that really appeals to me as an agent, as a broker, I broker for multiple companies. Community Care, their customer service, if you drive around Tulsa, you'll see the billboards that say number 1 in customer satisfaction. The reason for that simply is they're local. So whenever you pick up the phone, more than likely you're talking to somebody in Tulsa. Very efficient customer service. You can take a picture of this page. If you ever need them, they're right there. If you can't get a hold of me, you're not talking to someone offshore that you can't understand, okay? All right, so let's look at these 3 plans. Any questions on any of that? Wonderful. Okay, so you got 3 plans. All 3 are HMOs, okay? All 3 you must stay in network. When we get done, I'll be glad to look up any providers that you see if you want to be sure they're covered under the plan. I'll also be glad to check your prescriptions to be sure that your prescriptions are covered under the plan's list. You have the Silver Plus, Platinum, Platinum Plus. Now, on top of what they take out for your Part B, if you do the more popular Silver Plus plan, you have a 0 monthly cost for everything. Platinum, $19, $83 on Platinum Plus. Not a great deal of difference between the Platinum and Silver Plus, maybe a few dollars. So you just have to weigh out if it justifies adding the extra $19 a month, okay? First off, there's no medical deductible on all 3 plans. Second, you have what's called a max out of pocket. Okay, on the Silver Plus, it's $4,200, $3,900 on the Platinum, $4,700 on the Platinum Plus. Now, let me explain what that means. That is not a deductible, okay? What that means is on your medical, with the exception of dental, prescriptions, optical, if you were to spend out-of-pocket copays to reach excess, say of $4,200, at that point, Community Care would waive your copays on all in-network services the rest of the calendar year, okay? So, for example, you go on a hospital, you have a copay per day of $240 per day, days 1 to 5 on the Silver Plus. After day 5, you pay absolutely zero copay no matter how long you stay in the hospital. That's all you pay is the $240 a day. So if you have a $100,000 hospital stay, it's $240 times 5 if you stay all 5 days. That $240 a day comes off that $4,200. So you'd have to have about 5 or 6 hospital stays in a year to meet that max out of pocket. Does that kind of make it a little bit more clear on how that out of pocket max works? If you just have an outpatient procedure done in a few hours, they send you home, $235 copay. Primary care doctor is zero copay on all plans, and except for the Silver Plus has a $30 copay. Each time you go to a specialist, $25 on your Platinum and Platinum Plus. Preventive services, you pay nothing. Emergency, $90 copay, and urgent care, $30 copay. $25 on the Platinum plans, okay? Next page, diagnostic tests. Another thing I really like about the community care plan, on their tests, unlike a lot of their competitors in this area, lab work and x-rays, you pay absolutely nothing. When you get into other tests, it's 0 to 150, and your major MRIs and CT scans, $100 copay. Hearing, you pay nothing for a routine exam at your primary care, and you pay nothing for diagnostic hearing exams. Now, hearing aids, except for the Silver Plus, will allow you to be purchased with your Wallet Flex card, which we're going to talk about in a little bit. Okay, it's a MasterCard that's separate from your ID card that you get. If you take the Platinum or Platinum Plus, then they actually, part of your insurance pays for it. Up to $500 per plan benefit, okay?
They
To
get
be used once every 2 years.
2 cards with community care, MasterCard and the.
You get an ID
Mastercard
card with community care, plus
and MasterCard.
a MasterCard called the Wallet card, okay? All right, a fitting is not covered with the Silver Plus. With the Platinum and Platinum Plus, you pay nothing, okay? Dental, you get up to 2 exams and cleanings per year at contracted providers, x-rays, $1,500 in dental benefits, 50% coverage on crowns, root canals, dentures, okay? Medicare covered dental, it shows there's a copay for that, but Medicare dental is just non-existent or few and far between. Okay, vision on page 8. You pay nothing on covered vision. If it's a routine exam, this is you go read the chart, not if you go have your eyes treated for a medical condition, that you pay your copay, specialist copay. So if it's routine, you pay zero copay, and you get more than a lot of the other plans in this area. They pay up to $400 for eyeglasses, lenses, and frames, or contacts. You can do one or the other, okay? Now, they have the optical place here in town, Dr. Ward, so that's kind of nice to know. They're contracted with community care. Mental health is the same as the hospital copay per day. And then outpatient is $20 a visit. Skilled nursing, what skilled nursing is if you're in bad shape and they move you from a hospital, between going home, they move you to like a nursing home or inpatient rehab. In network, you pay a zero copay days 1 to 20 with community care, and $140 a day copay days 21 to 100. Physical therapy, $15 copay, and 10 on Platinum, 20 on Platinum Plus. Ambulance, I really like this also. You pay just a $250 copay for Medicare covered ground or air ambulance with community care, but that's waived if you're admitted in the hospital. Where a lot of the other carriers that offer Advantage plans out here charge you a copay, but they don't waive it. You still have to come up with it even if you go in the hospital. Also, community care covers transportation to your doctors. You get up to 12 one-way trips, not to exceed a 50-mile one-way limit. So for you, if those of you that live in this area, that would work if you're going up to the Tulsa area. Part B is medically necessary drugs. These are the drugs administered to you like a chemo treatment, a dialysis treatment. You have a 20% coinsurance. And then on page 9, we have the drug plan. We went over the stages, but there's 5 different tiers on this plan. Nice thing about Community Care, there's no deductible, like a lot of the other companies in the area. So you just go right into the copay stage. So for example, if it's a tier 1, you have a 0 copay. Tier 2, no more than $5. Tier 3, no more than $47 copay, 40% on tier 4, and $35 on insulins on tier 5, and 33% on specialty drugs. That's at the local pharmacy, just going down the street to an in-network pharmacy. But if you want mail, they have a very good mail pharmacy. When you get your welcome packet, Community Care sends you the forms to enroll in the mail pharmacy. I think they use Walgreens mail or CVS mail. And for example, your tier 1, you get up to a 100-day supply at 0 copay. I'm sorry, this is direct. This is if you're going local. So you multiply it times 3, and you get a $100 copay. On page 10 is the mail pharmacy copay. So your tier 1 and 2 go to 0 copay for 100 days. And tier 3, you get a pretty good break. Instead of 141 through the mail, it's only $94 copay. Not bad, okay? And then you also get a break on the insulins at $70 instead of $95 at locally, and then 33% on tier 5, okay? Now, all your Part D plans, you have the $2,000 cap, and they have different formularies to be sure your drugs are covered. I'll be glad to look those up when we get done if you volunteer those to me. Now, at the bottom of page 10, chiropractic care, $20 copay. Diabetic testing supplies like meter strips, things that you get or you pay nothing. And medical equipment, I really like, where a lot of companies across the board charge you 20% like traditional Medicare on your medical equipment. With a lot of medical equipment with Community Care, you pay absolutely nothing. 15% the cost of wheelchairs, walkers. If you are getting medical equipment, oxygen, CPAP, also, let me know when we get done. I'll be glad to check those providers to be sure they're contracted on the Community Care, okay? Page 11, this is what brings me to this facility. Now, I'll tell you something nice about being here. Most of the plans you see on TV do not cover a membership anymore here. Community Care doesn't give you an actual fitness benefit in the plan as far as the insurance, but you get a wallet card, and it's a MasterCard, and they let you pick your facility. Anywhere they take MasterCard, which this facility does, you can come in here, you just pay your membership fees out of that card. It makes it very simple for you and easy, okay? Then you don't feel like you're combined to a certain network of facilities. Home health, you pay nothing. You get a 24-hour nurse advice line at no cost, very handy. And then they have a very nice over-the-counter catalog where you get an $85 quarterly credit. I have those for you to take with you. They're also online. And this has a very good spread. It's got everything you can think of over the counter. The stuff that's on our pharmacy side of the counter, not the pharmacist side, it's very simple. If you order by phone, you just give them the item number and it gives you the cost. Now that $85 does expire if you don't use it at the end of each quarter, but it resets at the first of the next quarter. So you get that loaded 4 times a year, yes.
So those purchases are made over the phone or like online?
Through the catalog, over the phone, online, yes, sir.
The catalog.
It's called the Nations Organization.
I just figured that's a question I'll get asked, so that's why I'm asking.
Okay. Personal emergency response systems, you can use your wallet benefit to pay for that as well, okay? On the next page, prosthetics, those are like artificial arms, limbs. You have a 20% cost share, renal dialysis, 20% cost share. And telehealth, you pay nothing if you have to telehealth your doctor or your primary care. So let me talk about how this wallet benefit works. The wallet includes fitness membership, personal emergency response devices, hearing aids, non-Medicare covered durable medical equipment. You're gonna get $500 loaded on the card for this year. And that's, except for the Platinum Plus, you just get $300, okay? Now, what's nice about that, again, that starts for this year, you get the full $500. So if your Medicare starts in June, you get that, you've got it to use the rest of the tier. Again, your ID card you get, and then you get a separate plastic MasterCard, which is what this $500 is loaded on, that you can use it for those things only. So the fitness is a very appealing thing. If you work out here, you can just pay your membership out of that, or any place that takes MasterCard. That kind of wraps that up. Are there any questions? Okay, you want to go ahead and end that? All right, we're done.